Okay, so let's get into it because there's been a lot of discussion for decades, particularly within the research community, in terms of how do we make the policy follow the science, and or actually be how do we have policy informed by the science. And there has been a lot of frustration anecdotally, certainly within, I would say, the research as well as policy community alike. So my question then becomes, why did EASO decide to undertake such a research gap analysis? It's a big deal.
Well, Jacqueline, obesity acts as a gateway to many other non-communicable diseases, such as diabetes, cardiovascular diseases, and several types of cancer. But despite recent advances by the EU in officially categorizing obesity as a chronic disease, there are currently no clearly set parameters for determining the severity of the disease within the same policy frameworks as already operational for many other major non-communicable diseases in the EU. And much more remains to be done to ensure that the EU research agenda priorities reflects the needs from different stakeholders who are tasked to improve our understanding of the onset and progression of obesity, as well as obesity management.
So what was the scope of the analysis? How did this work? What did you cover?
Well, the analysis was performed in broad consultation with 36 different organizations, including WHO Regional Office for Europe and OECD. And the survey identified several key areas for improvement. So first, the surveyed obesity community highlighted that the EU maintains an overemphasis on primary prevention of obesity, primarily in terms of a diet and physical activity perspective. So obesity is often simply hidden in general policies that focus solely on lifestyle. So the European obesity community strongly encourages the funding bodies to take a more holistic approach, which reflects the needs of all people at risk of developing obesity and related complications, as well as those already living with this chronic disease. And this implies that the focus should be on understanding the onset and progression of obesity and its complications, primary prevention, treatment, as well as the long-term management of obesity. And therefore, we encourage the European Commission to name obesity cause for all stages of the disease continuum and not only for primary prevention. So future research goals should be split into smaller, more focused areas to allow targeted research that will generate real impact. And in particular, the basic signs of obesity should be more fully addressed in future research goals, since differences between individuals in terms of the onset and progression of obesity and the development of complications are apparent, and there remain research gaps between the biology of obesity and the impact of the physical and societal environment. And this holistic approach is really needed to support meaningful, personalized pathways for prevention, treatment, as well as the long-term management of obesity and its complications.
So I think anyone watching this and reading the report is going to say, that's fantastic. That is absolutely where we need to get to. But, and of course, there is always a but. Did the consultation results actually indicate what would be needed to facilitate implementation? Because clearly that's always going to be the most challenging hurdle.
Yeah, exactly. Well, the stakeholders involved in this consultation indicated that a clear and scientifically accurate vocabulary classification and usage of obesity as a chronic disease is needed, allowing them to make meaningful policies to address obesity as a chronic disease in line with the European Commission briefings and research priorities. So this vocabulary should be mainstreamed across all research programs which can impact obesity and other non-communicable diseases. And moreover, there is also a need for a comprehensive mapping and gap analysis of what kinds of obesity data, which could be useful to measuring obesity-related health and societal outcomes, is currently available and lacking. So for example, timely, accurate and consistent recording of health data in digital records may benefit patients with obesity. And finally, but not less important, one of the gaps highlighted in the consultation is the lack of accessibility of stakeholders who are forming the research priorities to enhance and actually encourage involvement of key stakeholders, both at national level and across EU institutions.
There are clearly some gaps, both in terms of the actual questions which are being addressed, how they're being addressed in terms of setting parameters, and also gaps to ensure uptake. So assuming in a perfect world that all of this comes to pass, what would you like to see happen? What are the desired outcomes for you and according to the 36 other organizations' inputs?
Yeah, that's an important question. And we sincerely hope that this report from EASO will shine light on the evidence gaps which currently exist, and that policymakers will build on the recommendations outlined in this report to ensure that the necessary approaches are pursued to better understand the onset and progression of obesity and its complications, as well as the effects of tailored prevention and treatment strategies, and also to achieve the translation of evidence into policy and practice. And I think these actions are urgently needed to reduce the prevalence and severity of obesity and its complications, which ultimately will have a major impact on the quality of life of EU citizens and society at large.
Wonderful. I couldn't agree more, but I would say that. So, Gijs Goossens, thank you so much for contributing to this edition of In Conversation With. And we look forward to actually implementing and activating what's missing in the EU research agenda recommendations from the European Association for the Study of Obesity. Thank you.
My pleasure.